Hello. Thank you very much for allowing me to speak to you on telehealth and physical therapy. My name is Tyson Arden, and I'm a physical therapist, and I appreciate the honor from Dr. Ellen McGough to allow me to come speak to you guys. So we'll get started. Um, the name of my presentation is Telehealth and Physical Therapy, and I'll tell you a little bit about myself. I started in telehealth in 2020 during the coronavirus pandemic and have been doing some form of it ever since. And now here we are with the changes in telehealth in general. And I'll explain some of those to you. So, starting, here's the agenda for today. We're going to do an overview. We got some research that we're going to go over, talk about the environment of telehealth and some of the equipment that we use, some of my own personal experiences, as well as considerations and info for other items as well. Okay. So sometimes I feel like this explains it pretty well. So starting off, what is your understanding of telehealth? When do you think it should be used? And when do you think it should not be used? Is telehealth more or less effective than standard in-person care? And why? Why do you think that? And what is your level of comfort using technology? And what if telehealth was your only means of seeing patients? All right, Dr. McGough, I'll let you stop the recording and talk to your students. Okay, welcome back. So now we're going to go over some of these questions. So first off, telehealth in general, it's an umbrella term to use to describe the delivery of healthcare services at a distance using information and communication technology, also known as ICT, and includes all healthcare professions. So doctors, nursing, physical therapy, everyone can do it. The adoption of telehealth services has been slow and is thought to be due to these main factors. And the first one being cost. Um, there's a lot of training that goes into it, and people think that it costs a lot more than it does, and just training and with all of the implementation of new technology, new software, sometimes those cost money, so that can be a deterrent factor, as well as the key demographics of the patients sometimes don't play into the favor of doing a telehealth session. And finally, clinician acceptance. So there's been a poor clinician rate of acceptance. And the paper that I gave you goes into a little bit more details. But COVID-19 has forced the resurgence of adoption by the healthcare professionals in general around the world. So now they're using telehealth therapy for all kinds of services. So the research says that based off of preliminary research, telehealth can improve pain function as well as reduce disability, similar to standard in-person therapy for musculoskeletal conditions that range from non-specific low back pain, total knee arthropathies, as well as osteoarthritis. Another systematic review found that low to moderate concurrent validity for several orthopedic and neurodynamic tests, as well as lumbar posture assessment. So there's a lot of tests and measures that you can use that have low to moderate validity for their use. Diagnostic agreement was found between in-person and telehealth assessments ranged from 59% to 93.3%, which is pretty across the board, but also that 93% is awesome. As far as satisfaction levels, they're reported to be high in some cases, and actually found to be higher compared to in-person care. And we can go a little bit into that, why that is. And there's a lot of theories as to why that is, but generally people like to be in their homes. They like that they don't have to drive somewhere, and it's just ease of access for them. And also this final point here and the research that it can be really cost effective, with the savings mostly being extended to the healthcare service. So you don't have to have a brick and mortar place where you see your patients. You can see them in the comfort of your own home, which is, a really convenient thing for and cost saving benefit for the therapist. Okay. So some of the discussion questions I have again for you are: what are some clinical considerations for preparing the physical therapy environment for a telehealth consultation, and basically in your home? And can you think, or office, can you think of any items that a patient may have on in their house or around them that they could be used during the PT session? And finally, how would an online telehealth evaluation be different from an in-person evaluation? And so I'll let you guys discuss that, and we'll go ahead and pause. Okay, welcome back. So I want to go over the environment first of all. And this is a chart that I got from Cottrell and Russell, the paper in Telehealth for Musculoskeletal Physiotherapy. So starting with considerations for prepping the physical environment for a telehealth consultation. So you need a space large enough to perform necessary tasks, such as performing an exercise. So normally I would have a table set up behind me so I can go show some exercises for the patient. You want to be free from clutter, and avoid potential trip hazards for yourself. And you also want it to be private. You don't want, people to be able to walk by, or too many loud noises. Eliminate any background noise as much as you can. I've tried to do that, but it's not, you're not always going to be able to avoid that, and that's okay. I just want to close all the windows and doors. Normally, I have a headset when I'm on a call with a patient, as well as making sure any like physical spaces, the carpet is a good idea to minimize noise. You want to encourage that neutral colors and make sure nothing's too flashy, as well as choose artificial lighting, because sometimes the sun can cause shadows. So you don't want the shadows to be like on your face when you're trying to, or on your person when you're trying to show an exercise or a technique. And encourage clothing that is loose and you're able to move around in, as well as don't create visual disturbances for the patient. So yeah, so that's some on the environment. Oops. So this is equipment needed. So these are the things that I have found helpful in my evaluations, as well as follow-up sessions. So starting with the basics, you need a computer, phone, or tablet. Of course, working Wi-Fi, and a nice open space. A treatment table, like we talked about. I always go with wireless headphones. I think that's the best. And make sure that your online patient forms are ready to go, as well as quiet. You want to make sure that the space itself is not loud. So, in terms of what you do in your evaluation, you have a goniometer that can help measure range of motion, just how you would in person. So, if someone's turning to the side and you want to measure shoulder flexion, you have them go like this, and then you put the goniometer up to the screen and actually measure. That's why you need a small or medium-sized goniometer. Use a timer or stopwatch. Those are extremely helpful for when you're counting exercises, stretching, and that sort of thing. So also for your outcome measures sometimes. Speaking of outcome measures, you want to use these. I have found to be extremely helpful because they're quick, and they do a good job of measuring what they're supposed to measure. So the quick dash for shoulders, we got the shoulder physical and disability index, the oswestry, the NDI for the cervical, and the CUS 12, which is great for the knees, as well as the LEFS, so the lower extremity functional questionnaire. Um, Basically, you want to use these because they're quick, they're easy to use, and they've been demonstrated to be useful for most of the patient population that you'll be seeing. As far as a follow-up session, this is where you can get really creative. I have found that water bottles are helpful to build strength. We use them as weights, as dumbbells. You use a small towel for a lot of the neck mobility, shoulder mobility type things. and a cloth belt or a large towel for flexibility. So that can be used for calf stretch, hamstring stretch, as well as just general lower extremity flexibility. I found resistance bands are extremely helpful for patients. Sometimes they don't have those available, so you have to get creative and just do isometrics. Um, and then finally, using a small bounce ball has been found to be helpful for me in dynamic stability control. So sometimes I use it for the shoulders, sometimes I use it for the cervical spine. It just depends on what the patient has going on with them. But if they have that available, it's something great that they can use. So my experiences in telehealth are that it provides you an interesting opportunity to see their own living conditions, and really you can make suggestions based off of what the safety concerns that you have after seeing their space. You know, do they have loose carpet around that they keep tripping on? Is the dog running around crazy when they're trying to do their exercises, causing the patient to almost trip? These are things that you want to watch out for to make sure that you're giving your suggestions. Connection issues, trouble with login, all these things, camera setup, they can be common challenges that you can find during a standard telehealth session. You have to be very prepared to navigate these challenges, as well as have an action plan in case something does happen, so that you are prepared. Patients may have family members available for you to talk to them, and make sure you take those opportunities to educate. They also may just interrupt your session, and that's unfortunate, but you just keep going after they have left the room. Awareness of the lessons I've learned are you have to be aware of the potential dangers as well as safety hazards, and have an emergency plan in case something happens. Technology is not perfect and you'll always have issues, but you'll just have to adapt, and you will be able to adapt. Education for patients and their family members are key, um, and always lead the session in a logical pattern and redirect when necessary. Don't be afraid to say, I'm sorry, but we need to get back to the task on hand. We only have 20 minutes to get this session done. So I want to make sure that you get the biggest benefit out of this, and just redirect when you need to. So I'm going to explain to you about a time. I will discuss the time when my patient almost fell out the window, and the conversation I had with his caregiver and my supervisor. So starting with my patient, we were doing some standing exercises, and as they were getting closer to their wall behind them, they were backing up. They tripped and luckily caught themselves in a chair, but almost went out their window, because there was a window about mid high, and so it was extremely terrifying for me and the patient. So I wanted to make sure I talked to his caregiver, who was also his wife. So I said, "Oh, why don't you have a seat and let's talk." And we spoke about it. And what I said to her was that he's a significant fall risk, and it'd be good for her to have him see his medical provider, his doctor, in order to possibly go over some treatment options, make sure he's seen a neuro, so that he's getting covered in all aspects of it. So sometimes you have to take the time during the session to provide that education, but it's so important. And it's really important that the patient is safe even when you're not there. And if you notice these things, you can make suggestions. I also suggested that they put a barrier in between the room and the window, so that the patient doesn't go have that scary situation again. So you just have to make suggestions. And then afterwards, I spoke to my supervisor about it and explained to her why that needed to take place and what happened and all that. And she was on board and glad that we did that. And we had that conversation, because the next steps is that they'll go in and talk to their doctor about that. And that's what they did. So luckily, nothing happened, but that's time. That can happen. So another time I had to refer out was um, my patient. This was the first session, and they couldn't do any standing at all. So they couldn't, for the evaluation, they got into a car accident and they were in a wheelchair. And I didn't feel that I had the enough tools to be able to properly evaluate this patient. So I referred them to an inpatient physical therapist. And at the time, the patient was a little bit, I kind of left it up to the patient in a way. I said, do you feel that you'd be you'd be better treated by an in-person therapist? And he agreed to that. And so I made the decision to ultimately get him seen for in-person care because I felt like he needed a higher level of care, whether that meant proper guarding, proper ability to be able to assist when when you need to. So in some cases, you'll notice that the patient may not be the best fit for telehealth. So you just have to make a judgment call based off of your experience and your training as a physical therapist. And that's what I did. Whether it was right or wrong, I don't know. So here are some implementing considerations when you're doing a telehealth service. So the first thing you can do is use frameworks or action process models. This one example is the knowledge to action model. There's a lot of research on this. And so if you're someone that likes to follow pre-drawn models and um, concepts and theories that you can follow, that's a great place to start. The second thing you need to do is identify the patient's needs. Determine, are they going to be living at home? Who's going to be taking care of them? What kind of access do they have as well, which is the pre-implementation consideration. You have to think about patient access. Do they have a computer? Do they have someone that can be there to help with guarding if needed? Those types of things. Now, in terms of clinical considerations, one thing you need to figure out is individual patient factors. So, is this patient going to be a good fit for telehealth services? Do they need a higher level of care, in-person therapy? You also want to consider the mode of delivery that you're going to be delivering either telehealth physical therapy services through phone or tablet. Are you going to do a synchronous or asynchronous presentation like the one I'm doing today? And also, how what plan are you going to use? Are you going to use Zoom? Are you going to use? Do you want to make sure that it's HIPAA compliant and that you're checking all the boxes in terms of patient uh, necessary things? Okay, so the next thing you're going to look at is the clinical experience or the skill sets of the provider. So, do you need to shore up any of your knowledge and any of your understanding of how telehealth is provided so that you can provide a better service overall? And finally, the last thing you need to one of the last things you need to consider is reimbursement rates. Now that's changed over the past couple of years, but Medicare now is reimbursing for services, but you'll have to check with your state practice guidelines in terms of what they cover and what they do not. In telehealth platform selection, that can be the specific software that you use. One that I used to use was DoxyMe, and that's a great software to use. It's free to use. Doxy.me, and it's a great free service to use. So some of the general principles in telehealth that I've learned is that isometrics and PNF patterns are effective training methods, and they should be used early and often because they're going to form the foundation of uh, strength with your patients a lot of the times. So if you can use these and you can get really good at teaching these, it can be really helpful for the patients. You want to inspect their home environment and make suggestions to improve their safety. We talked about this a lot, but I just can't ignore this fact. I think it's the most important aspect of telehealth physical therapy, and it's something that you should always be thinking about. Learn to rely on your non kinesthetic senses. It's using your eyes, your ears, your observation senses. What does the spine look like? How is a patient moving? These are all things that you can look at just based off of your observation of the patient. Educate the caregivers and the family members often. You want to make sure that they're getting the message across. as far as what's safe, what isn't safe, what changes need to be made, and the delivery, the normal physical therapy delivery options. Don't be afraid to try new things if it doesn't work well, and adjust often. So if the call's not going through, who can you call? Make sure you have an action plan in place so that you're not stranded if something does go wrong. Thank you for the opportunity to share with you. I hope that this was helpful.